Cats are skilled at hiding their pain, but there are several signs that can indicate when a cat is suffering or in pain. Recognizing these signs can help you get your cat the appropriate care and treatment they need. Below is a detailed list of 30 signs your cat might be in pain and suffering. 1. Changes in eating habits. Cats in pain may eat less or stop eating altogether. This can be due to oral pain, digestive discomfort, or a general lack of appetite from illness. Conversely, some cats might overeat if they are stressed or anxious. 2. Changes in drinking habits. Similar to changes in eating habits, cats may drink more or less water if they are in pain. Increased drinking can indicate kidney disease or diabetes, while decreased drinking may signal mouth pain or other health issues. 3. Lethargy. Pain can cause a cat to become more lethargic or less active. If your cat seems unusually tired, sluggish, or doesn't want to engage in play or regular activities, it might be experiencing pain. 4. Hiding. Cats often seek solitude when they are unwell or in pain. A sudden tendency to hide in places they usually don't frequent or avoid human contact is a red flag that something is wrong. 5. Changes in grooming behavior. Cats typically groom themselves regularly. If they stop grooming or groom excessively in one area, it could indicate pain, especially if the grooming is focused on an injury or arthritic joint. Excessive vocalization. Cats in pain may vocalize more than usual. This could involve meowing, crying, or growling in response to pain. Cats may also make soft, painful-sounding meows when they move or are touched. Changes in behavior. A cat may become more irritable, withdrawn, or aggressive due to pain. Pain can make them feel vulnerable, and they may not want to be touched or handled as they usually would. Decreased social interaction. Pain often makes cats avoid interaction with their human family members and other pets. They may become more distant, less affectionate, or refuse to engage in their usual activities with people. Difficulty walking or lameness. Cats with pain, particularly in their joints or legs, may have difficulty walking. They may limp, stagger, or avoid putting weight on certain limbs. Stiffness. Cats in pain, especially older cats with arthritis, may exhibit stiffness in their movements. You may notice them moving more slowly or having difficulty jumping or climbing. Shaking or trembling. Shaking or trembling can indicate pain, especially if the cat is in extreme discomfort. It can also be a sign of anxiety, fever, or other medical conditions. Restlessness or agitation. A cat in pain may have trouble settling down. You may notice them pacing, meowing, or shifting positions constantly because they are uncomfortable. Change in posture. Pain can cause a cat to alter its posture. They may arch their back, hunch over, or adopt a strange position to avoid putting pressure on a painful area. Panting. While panting is rare in cats, it can happen when they are in significant pain or distress. It could also indicate respiratory problems or a severe medical condition. Dilated pupils. Pain or stress can cause a cat's pupils to dilate. If the dilation is persistent, especially in low light, it could indicate pain or anxiety. Aggression. Some cats may become aggressive when they are in pain, even if they are normally gentle. This behavior might manifest as hissing, biting, or swatting when touched or handled. Increased heart rate. Pain can cause a cat's heart rate to increase. If you can feel your cat's pulse or notice it is racing, it may be a sign of acute pain. Abnormal breathing. Cats in pain may exhibit irregular breathing patterns. This could include shallow breathing, rapid breaths, or even labored breathing, depending on the severity of the pain. Vomiting or diarrhea can be a sign of digestive distress due to pain or illness. Cats might vomit if they are in pain from an internal injury or an illness, such as pancreatitis or kidney disease. Unexplained weight loss can also be a sign of chronic pain, especially if the pain is related to conditions like cancer or arthritis. Cats may stop eating or have difficulty chewing, which can lead to weight loss. Inappropriate elimination, like urinating or defecating outside the litter box, can be a sign that a cat is in pain. This behavior might be due to physical discomfort or anxiety. It can stem from urinary tract issues, gastrointestinal pain, or stress from an injury. Additionally, a cat in pain might have tense or tight muscles. You might notice this through their stiff movements, or if you gently feel their body. This is quite common in cats experiencing joint pain or internal discomfort. Cats in pain may focus on licking, biting, or scratching at a specific area. This behavior could indicate that they are trying to soothe a painful spot or that there is an ongoing injury. Furthermore, a cat in chronic pain might develop a dull or unkempt coat because they are too uncomfortable to groom themselves. Hair loss can also occur if the pain is due to skin conditions or severe stress. Restlessness at night. Cats may show signs of pain by being more active or restless at night when it's quiet. Pain can interfere with their ability to relax or sleep properly. Excessive salivation or drooling. Break time. Point 5. Pain in the mouth or throat can lead to excessive drooling. Cats may salivate more when they have oral infections, dental disease, or injuries in the mouth. Changes in eyesight. Severe pain can sometimes cause changes in a cat's eyesight. A cat may avoid bright lights, or you may notice that their eyes look dull, or they squint or keep their eyes closed more than usual. Disorientation or confusion. Severe pain, especially due to head trauma or neurological issues, can cause a cat to appear disoriented. They may seem confused about their surroundings, or have difficulty recognizing familiar people or objects. Swelling or visible injury. Visible signs of injury, such as swelling, bruising, or cuts, are obvious indicators of pain. Swollen limbs or joints, or localized swelling on the body, can point to an injury or infection that causes discomfort. Change in facial expression. Cats often should show signs of pain through subtle changes in their facial expression. They may squint, frown, or show a tense, tight expression, especially around the eyes and mouth. Understanding the signs of pain in cats is crucial for ensuring their well-being. Cats often hide pain as a survival mechanism, so any noticeable changes in behavior, appetite, grooming, or mobility should not be ignored. If you observe several of these signs in your cat, it's important to consult a veterinarian to determine the cause of their distress and get appropriate treatment. Thank you for watching. Do comment about your experiences.